Hello, Dr. James Bogash, expert in health and longevity, and yet another disturbing study, not in its surprising outcomes, but rather in the data that it suggests, and I'll get to that in just a second. This article, the study has everything to do with atrial fib, or commonly known as AFib, and this is where the atrium just kind of vibrates. Most people will notice this as a palpitation. A palpitation is just, we're not normally aware of our heartbeat, so when we are aware of it, because it's not beating the way it's supposed to, that's called palpitation. One of the causes of palpitation can be AFib. Now, AFib can go from not being a problem to affecting the flow of blood flow through the heart, not as much as ventricular fibrillation, which can be rapidly fatal, but also can lead to some disturbances in blood flow. Anytime you have a disturbance in blood flow, you run the risk of having clots and throwing off a stroke. So it's a very real scenario, but the way it's been looked at and managed is clearly off kilter. And generally the recommended approaches these days is the AFib better care pathway, known as the ABCs. So it's avoid stroke or anticoagulant. So thinking about these days like Xarelto, before it used to be Plavix, Coumadin, anything that's going to keep the blood from clotting. The B is better symptom control. So that can be things like beta blocker. It can be like selective calcium channel blockers, and the medication pathways. And the C is cardiovascular risk or comorbidity management. Unfortunately, like, this is the biggest chunk. This is the chunk that should be managed with lifestyle. However, the recommendations generally look at management of these risk factors with, you guessed it, medication. Which brings us back to this particular study. So the ABC, taking this approach, definitely leads to better outcomes, lower risk of pretty much everything, lower risk of stroke, lower risk of heart failure, everything else that we want to happen or don't want to happen, it lowers the risk of. So we look at this study, and obesity is, like, we have this concept of metabolically healthy obese, and that's really a misnomer. There's no such thing. We like to think that there is, but there really isn't. However, you can have a spectrum within that. You can have people that are overweight and healthier, and you can have people that are ideal weight and not healthy at all. So when we start looking at metabolically healthy, that becomes a far more important marker. And certainly metabolically healthy ideal body weight is the holy grail. That's where we want to hang out. So in this study, looking at almost 25,000 people, they kind of teased apart how much BMI, so obesity or overweight, played a role in AFib and how it was managed and the outcomes with AFib. And when they first looked at the high level, the obesity, like overweight and obesity, this is the bothersome part. 72% of the people in this study were overweight or obese. 72%. Like, that's huge. And then they looked at people who were metabolically unhealthy, and they described these as people with high blood pressure, diabetes, or dyslipidemia, so like high cholesterol. It's a very small list, and like, I would look at metabolically healthy as a lot more particular than that. I think that this misses using only those through diagnosis, which again, those generally require medication. So what if you have, like a 135 high blood pressure and you're not enough to be medicated? I would still consider that metabolically unhealthy, but you might not quite get the label of having hypertension. And if you're pre-diabetic, you're not labeled as diabetic, and yet that's arguably worse for you than being diabetic. So given that pretty narrow, simplistic version of metabolically unhealthy, in this study, 84% of the people with AFib were metabolically unhealthy. it just still astounds me how metabolically unhealthy we are in this country. And that plays a role in everything health related. And until we start to understand and address that and take that seriously, we'll never get ahead of the health problem. They'll just continue to get worse because our diets are getting worse. We're getting older as a population. It's just, like, that floors me. And that's 84% of this narrow definition of people only with high blood pressure, diabetes, or dyslipidemia. We're missing a huge chunk. I would venture to say that 100% of the people in this study with AFib had metabolic dysfunction. So the bottom line is, when we talk about AFib, your best way to manage AFib, like, certainly you want to avoid stroke, you want to avoid all of those other things that go with it, but the long-term approach, or avoiding AFib, is about getting from I'd say cardiovascular health standpoint, but if you're metabolically healthy, you're lowering your risk of everything that you can be exposed to. And even looking at just simply Life's Essential 8, which I think is a great baseline. There's some aspects within Life's Essential 8s from the American Heart Association that I think should be stronger, but that's still a really good base. And using that, you've got 93% of the population is metabolically unhealthy. So managing AFib in the long run, or avoiding it in the first place, is a metabolic problem. We need to address it from a metabolic standpoint and improve your cardiovascular health. Anything else is just going to mildly lower your risk, and we have this idea that people come in, they're like, oh, I have high blood pressure, but it's under control. The mindset is all screwed up. It's not under control if you're being medicated for something. So take that as the principal take-home message of this study. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.